One of the most important toxins that we can be exposed to is our negative emotions, negative feelings, and being stuck in a lot of rage and frustration and a lot of those toxic emotions that are definitely changing the biochemistry of our cells and our bodies.
All right. So, hey guys, welcome back. This is a place where we provide hope and true healing from your chronic suffering by treating the whole body systems, not just your individual symptoms. Today, our guest is going to be breaking down ways to treat the complex diagnosis of fibromyalgia. If this is you or someone you know, someone you love, just stay tuned as Dr. Sara Alfaro will walk you through non-traditional therapies to tackle this condition that is characterized by such widespread pain and suffering. Dr. Sara comes to us from El Salvador. Thank you so much for being here with so many credentials, including medical doctor and training in bioregulatory systems medicine. She will go into that a little bit more as we get into the podcast, but her main expertise is in treating chronic pain. So you fit right into this podcast of ours. Welcome, Dr. Sara. Before we dive into fibromyalgia, I just had a quick question because most people we interview really start in traditional medicine and there's a moment in their life that they say, I'm done, and they come over to integrative medicine. What was that moment for you?
Hi. Well, first of all, thank you for inviting me for this podcast. It's really fun to be talking about these things I love to do. And I'm a medical doctor with, I did surgical residency, and then I did physical medicine and rehabilitation specialty, 3 years of PMR. And when my second son was born, he had a lot of allergies. He had bronchiolitis and was started on steroids at about 4 months old. And I remember the first time that he was using the inhaler and he was literally like sucking the air out of the inhaler. And my husband told me, we have to do something because we're not going to have this life for this kid, all the time in hospitals and with steroids. And I started researching what else could I do. It was back in 1996. And I found this colleague of mine who had trained in what it was called at the time biological medicine or anti-homotoxic medicine with the Germans. And my husband said, why don't you go and train yourself? And I said, well, I can't go and train and leave the kids. And he said, no, I trust you. So if we're going to start in a new journey, I want you to be the one that leads our kids in that journey. So I went and I trained for 3 consecutive years, going back and forth with the German school from Heal Pharmaceutical. And I did what it was called at the time biological medicine, and now it's called bioregulatory systems medicine. And it's pretty much, it changed the whole way that I look at disease and health and all the treatments. And it's mostly homeopathic based, but we do a lot of IV therapy and ozone therapy and mind-body techniques also. So from then, I changed the way that I still do physical medicine and rehabilitation and pain management, but with a different outlook on how we can treat the whole person, not just parts of it and treat the pain part of the situation, but the whole individual body and mind. So basically that's 27 years ago that I started with this, and I never went back to, normal prescriptions.
It's wild because we're here today to talk about pain. So it is nice that the history and traditional kind of is paired now with what you do. It all kind of came together in a nice picture. When I was Googling, thank goodness for Google, when I was Googling fibromyalgia, the definition pops up and it's pretty broad and all encompassing. It's almost a little generic. So just for our listeners out there, this is a disorder characterized by widespread musculoskeletal pain, accompanied by fatigue, sleep, memory, and mood issues. I really want to paint the patient's journey of the struggle. Does that characterize it pretty well, or is there something you would add to that definition?
Well, being a rehab facility, physical rehabilitation facility, I get a lot of referrals from people, especially women, that have been diagnosed for years with migraine, chronic fatigue or low back pain. And after so many exhaustive tests, analysis, and multiple specialties, they end up in rehabilitation, and we figure out the diagnostic that it is definitely a fibromyalgia. But in the way that I see the way that we manage these patients, first of all, is by not labeling them with a definite stamp of seal of a definite diagnostic like fibromyalgia. Because if you look at the information out there, when you give this stamp seal of a diagnostic, it's like a final thing of, it's not going to be cured. There's no hope, basically. So what I've been able to explain to the mostly women is that it's a condition that is characterized with a disorder of the nervous system, the immune system, with a lot of fatigue, mitochondrial dysfunction, and chronic inflammatory state. So if we start addressing all these areas and change the way that we treat our body and communicate with our bodies, we're going to start seeing a reversal of most of the different symptoms that they're experiencing. So it's basically starting to talk again with your body and incorporating what your body really requires in terms of diet, in terms of movement, in terms of all the physical therapy, and a lot of antioxidants and ozone therapy and homeopathics, and a lot of changing the mindset, because one of the most important toxins that we can be exposed to is our negative emotions, negative feelings, and being stuck on a lot of rage and frustration and a lot of those toxic emotions that are definitely changing the biochemistry of our cells and our bodies. So it's a very integrative approach, but with the center of the approach is how we teach the patient to start communicating again with her body, to know what that body requires. Because although we as doctors can recommend, different things, it's really the patient's body that is going to give the person the awareness of what is required. Do you need more sleep? Okay. Do you need more movement? Do you need more water? Do you need more food? So that's the first key step, is getting back that communication with your body.
So that you bring up a really good point when discussing the brain, because the first thing when you do put something into Google, you get a pretty dismal outlook on the potential incurability of fibromyalgia. And so to have someone come in with that ideal that the rest of their life will be classified under this condition and they will live with chronic pain the rest of their lives, it is probably a really hard feat to train your brain to think a different way and to find hope. How do you walk along someone with that?
Well, they first need some management of the pain situation and to help minimize inflammation, and that's where therapies that are multi-targeted, like these homeopathic formulations, really help, like Traumil, for example, Spascuprel to aid in the muscle spasm, and other areas like ozone therapy that is going to gradually and step by step increase the antioxidant production of the person's body, and again upregulate the mitochondrial function. And if we combine it with UBI, ultraviolet blood irradiation, we also get a modulation of the inflammation and an increase of the immunological system, which are the two components that are basic to fibromyalgia: a dysfunction in the immunological system and also a dysfunction in the nervous system. So we're treating the most important systems in the patient with ozone, UBI, and the homeopathic approach.
So you're finding the best way to really address the hope in this diagnosis, or as you say, lack of diagnosis, right? Because we want to remove it, is to start with addressing the pain situation, get someone feeling better, and then start bringing in a mental awareness of hope and mental health.
Well, it really is a combination, because as we modulate the inflammation, because we don't want to cause anti-inflammation, anti-inflammatories are not the drugs to take. It's modulation of the whole inflammation, chronic inflammation. But at the same time, it's looking at the pain through a different perspective, because when you overemphasize on the pain, you tend to have all your awareness in that specific place. You tend to increase the secretion of all the neuropeptides and all the chemicals that are involved with pain. And you're causing almost like a reprogramming of your brain cells. So using different techniques, like especially breathing, conscious breathing, reconnecting to your body, reconnecting to pleasure in terms of reconnecting to sensory pleasure on how you eat the food, smell the food, regain that sense of touch, with putting your lotion in parts of your body that are not hurting. You're able to reconnect with the pleasure of having a body, of feeding your body with things that are exciting for your taste buds, and also doing activities with mild movement that get you back on this like joyous way of looking at life. It's not strenuous exercise, but it's lightly walking, or it's like, sitting in a garden, watching, more connection with nature. All of these things are going to help change your mindset towards the pain and not focus on the trajectory of the pain. Like, it starts here and then it radiates here and it's throbbing at some times and it's initiating and stopping. So when we focus on all the details of the pain, it's like all of our attention is put there, all of our energy is put in the description of the pain, and we never get out of this pain cycle. But it has to be a combination of modulation of the inflammation, regulation of the nervous system and immune system, plus changing the way you approach what you're experiencing in your body.
Now, we keep talking about pain. Is there a common thread of pain? What does the pain feel like to someone who's living with this condition? And is it localized to specific areas?
No, it's very varied. It's very hard to describe the pain because they describe it as throbbing pain, burning pain, with a lot of neuropathic component, a lot of nerve inflammation component, a lot of change of the sensation of the temperature. Like they have very low tolerance to temperature changes. There's a component of brain fog, almost like they can't really introduce new concepts. Like they feel like they're not really in the best mindset. There's a lot of sleep disturbances, which it increases all the symptoms, because it's when we sleep that our brains are like detoxing and our bodies are reconstructing new tissue. So there's a lot of low energy and a lot of irritable bowel syndrome, pelvic dysfunction. I mean, it's like so many different systems that are involved.
Now, what is your trigger when you see somebody and you say, that's fibromyalgia? Because from what I've read and what I've understood, it's commonly misdiagnosed.
Yeah, the most common diagnostic associated with it would be the myofascial syndrome. Patients that are consulting usually with neck pain, upper back or low back pain, like repetitive episodes. But in general, it's a patient that has at least 3 to 4 months of pain at different parts of the body. The low energy is very important. And sometimes the mood is also important. Like there's like no joy, like there's no enthusiasm. There's like this like chronic, almost like dismal sensation that things are not going to change. So it's a combination of, intense pain treated with different medications, accompanied with digestive problems. And sometimes it is preceded by a viral infection. Like they just had like a bad flu. And then after that, they started declining in, their general health. Sometimes we don't have a viral event previous to that. But most of the time, they do have a sleep component. Either they're very light sleepers, like, they wake up multiple times during the night, or it's patients that have a really hard time falling asleep.
Now, when patients come to you, is this someone who's been living with this condition for 20 years, or is this a year and it's easily recognized? What does the journey look like? I know we talked about just now common misdiagnoses, but is there a journey, an average timeline to them coming to you and you providing this different, non-traditional way of looking at their disease and providing them hope?
Usually they're referred by either their neurologist or their rheumatologist, because they've already been through all the laboratory exams. And in fibromyalgia, most of the lab work will be negative. I mean, there's really no distinctive lab work to diagnose fibromyalgia. So they've already had all their tests done, treated for a chronic migraine. They're probably taking already multiple pharmaceutical pain components. And they're referred to physical therapy because that's where usually we get dumped with all the unresolvable cases. Like when they can't figure out what else to do, let's send them to therapy. They'll figure out something to ease the pain. So that's usually the case. Sometimes they come after being evaluated from the psychiatrist because they are misdiagnosed with chronic, depression, and they refer them to us because of all the pain components. So it's usually a woman that has been in treatment for at least 12 to 16 months prior to starting this new approach.
Now, you mentioned they come a lot of times on multiple pharmaceuticals. Is it an easy road to convince someone to slowly titrate or come off of these drugs while amping up immune supporting therapies, or is that a difficult tension?
Well, most of them have already tried multiple combinations. And although the pain level might drop, they might feel like from before taking the pain medication, they have a 9 in terms of pain appreciation, and it goes down to like a 5, but it's temporary. And most of them don't like the way the medications make them feel, like they make them feel even more groggy, even more distracted. It doesn't really help with their energy level. So contradictory to what you were asking me, the majority of them want to get off the medication. They don't want to keep using all these antidepressants and anti-inflammatories, and they have to take gastric protection medication because they're in so many different prescriptions. So they want to get off the medication.
We often talk about that with one prescription leads to another to treat the symptom of the first prescription. And so it is interesting how it's a ripple effect on that side. And intuitively, people, if they have hope, they have the hope to come off of that and be supported by their own body.
Well, most people want to educate themselves on what they're experiencing. And they already know that anti-inflammatory drugs are not helping their stomach and that are not helping their kidneys. And they want to get off of that. But that's why I emphasize a lot in not sealing a diagnostic, because when we tend to over Google, if you tell them you have fibromyalgia, then they go into this like frantic searching for more and more information. And what's out there mostly says that fibromyalgia will become a chronic situation. There's very few studies that show that fibromyalgia can be effectively managed by increasing, oxygen uptake, increasing energy levels, normalizing the whole inflammatory situation. So when they search just the diagnostic, the information is very depressing. It doesn't help. And you talked about placebo, but remember that we also can be nocebo effect in our own patients. So nocebo effect is when you tell somebody that that's uncurable, you're like sealing it and you're like telling them no hope. So I like to avoid that situation. And I usually explain that the body sometimes when it's overloaded with toxins and has less antioxidants and responding systems to balance this chronic toxic situation, it goes into disease state or into a imbalanced state. I use like these kind of terms instead of talking about you have this diagnostic, because that way it's easier when you look at it as health wellness as a continuum instead of I'm sick or I'm healthy. But if you look at it as a constant flow of interactions, it's easier for us to change that, because by each individual action that we're taking, that we're improving energy production with the ozone, that we're improving immunological system with the UBI, we're increasing the body's capacity to react and to self-heal. I mean, we're really relying on the body's amazing capacity to do self-regulation.
It is amazing. I love talking with people just like you who sit on the other side and have hope for these patients suffering in chronic pain, and just hearing those success stories, which I do want to get to some of those later. But someone comes to you, and we've already kind of touched on some of this. They have the imbalance. And I'm 100% with you on the stamp of a diagnosis sometimes is very, it puts a wall around you that there's no door to exit, right? You're just there. That's what you have. And so someone comes to you with fibromyalgia, and we talk about the body's imbalance. Is there a typical start? You had mentioned ozone, UBI, and a couple of things there. Will you walk our listeners through what kind of, if there is a typical fibromyalgia patient stereotype, what that would look like on a journey, kind of tying a nice bow on all the things we've just discussed?
Well, definitely. I mean, the basics is whatever nutrient you're bringing into your body has to contribute to your health and not cause extra toxic buildup. So, just ask your body. I mean, will this vegetable organically grown, will that be a contribution? Most probably, yes. But if you think about, triple burger with, Coke and French fries, is that going to be good nutrients for your body? Will this really, increase the nurturing of my cells? Most probably not, because there's so many chemicals and plastic things that you're eating that it's not contributing. So I'm not for a very strict, restrictive diet, because I think that the more we focus on, I have to follow this strict menu, it becomes almost like an obsession, like an orthorexia, like eating the right way. So I've seen a lot of people that go vegan that they're not happy because they feel very restricted. If it works for this body, well, then great. But if you have to choose a regimen of food that makes you feel happy, that makes you feel enthusiastic about, what am I going to eat in my next meal? So have that joy with the food, with the liquids that you're drinking. And definitely it requires physical therapy. I mean, fibromyalgia patients have chronic muscle spasm that ends up shortening the muscle length. There's a debilitation also of the muscle fibers. So we have to address the mechanical component of that chronic inflammatory area of the muscle. So physical therapy could be ultrasound, could be magnetic therapy, pulse electromagnetics, TENS. I mean, there's so many different options in physical therapy that they have to take. Massage also helps drain the liquid, helps increase the lymphatic drainage, which is also helping drain all the toxins out of the area. So we have food, we have physical therapy and movement. We also have the emotional component. And that's where we can see so many changes, because that's something we can't really change, the toxic environment that we live. That's beyond our scope of change. We can't really change that and move to a perfect natural place, but we can change the interior dialogue that we give to our bodies. So change that mindset. Ozone therapy will increase the antioxidant production and will increase the energetic production of the cells, which when we have a surplus of energy, the cells can repair whatever is required. Use UBI also to modulate inflammation and also to increase the immunological status of the person. So you have at least 5 different pillars, and the homeopathic approach, which is to drain, detox, and support the cell with different formulations. That it's a bit beyond the scope of this conversation, but using that anti-homotoxic approach, that's what it was called before, or now it's called bioregulatory systems medicine, where we give the cells certain preparations that help increase the release of the toxins that the cells produce from all the cell reactions, increase the nutrition of the cell, and give them cell information also, because homeopathy also has some cell therapy in very diluted concentrations. So that would be like, and also address the sleep situation. I mean, it's a very complex thing to manage, but we also have to get them to sleep in a more natural pattern. So that can be done with, breathing techniques, different essential oils that help, increase our relaxation, like lavender oil, or different preparations that you can use, or some homeopathics like Rescue, or some florals of Bach that you can use to help them get more relaxed and have a deeper sleep. Use melatonin, for example. I mean, there's a lot of phytotherapeutics that we can use, but with the goal of getting them back to sleep, in a deeper sleep. It takes about 4 to 8 weeks to really get a patient really in the recovery phase, and about 3 months to really change the way that they are living. And the first thing we notice is that they start feeling happier. They have less pain, they sleep better, they have more energy. You see them more enthusiastic, they have new projects. I mean, a lot of them were patients that were already going through, when you're laid off of work, like there's a compensation that you're in.
The Family Medical Leave Act.
Yeah, we have it here for about a year that they can take that medical, we call them incapacitation from work.
I'm thinking you're probably here in America, the long-term disability insurance.
Yeah, they're almost like getting to that point where like they're not working anymore. And with all these modifications, they really start to change the way they look at their bodies, and they are gentler with themselves, and they have a different approach to jobs also, because a lot of them tend to be highly competitive, like very great executive workers with very stressful jobs, highly perfectionistic people. So they start to change a little bit that demand on their body, and they start to listen to when their body requires some rest, when their body requires more movement or more free time. So there's a lot of psychological, mental, and physical changes that they experience in the length of about 3 to 4 months, basically.
So I'm someone listening, let's say from Kansas, and I don't live in El Salvador. I have a diagnosis of fibromyalgia, and I've been living with it for 2 years. I hear 5 pillars that Dr. Sara gives me to a path of hope, a path of freedom from chronic pain. And I say, I'm in Kansas. Now, the whole point of our podcast is to say there's people around here that will walk beside you.
Yeah.
What would you recommend to that person? Is there hope?
Yeah. What I usually do, we do some telemedicine where I have consultations with the patient where we go through all the symptoms and, establishing what are the priorities to treat or manage are. And then I usually connect them with, there's a big network of ozone doctors throughout the world, connect them to a local doctor that can do the ozone therapies. Remember, there's also rectal ozone that they can do on themselves. That's another very great therapy. It's not just ozone via MAH, but they can also do rectal ozone on themselves at home. And there's a lot of homeopathic products that they can purchase, through different pharmaceutical companies, and referrals to, the doctors that are in the area that do ozone and do UBI, and continue with that. Let's talk about emotional reprogramming or change the way we look at things. But that's what we do in the sessions where I accompany them, with asking them questions and getting them to recognize probably what emotion is underneath that symptom, or that pain. So that takes you can do these sessions. We do them sometimes with telemedicine. And the physical applications is something that we connect with the doctors that are in different parts of the world.
So that is just, because we often talk to people who are experts in their own space and they're not accessible by everyone who listens to that podcast. So just the thought and the knowledge that there is people around you. There is I call it a neighborhood integrative physician. It might not be in your exact zip code, but there is someone accessible, and you're accessible to a degree is what you're saying. So if you are in this chronic stage right now and you need help, email us. We'll provide you the list. Reach out to Dr. Sara. We'll provide some of that information as well in the show notes. I just thought those 5 pillars, some of them were, hey, I can do that, right? I can go out and get a massage. But some of them, you really need someone to walk beside you in this journey and give you hope for healing. Now, do you have 1 to 2 success stories of a woman? And like we said, this seems to be predominantly women who show up with fibromyalgia, but not exclusively. So I say a woman, could be a man who have walked into you and just chronically struggling, feeling like there is zero hope to heal. And 4 weeks later, they start smiling. They feel less pain. Yeah. 8 weeks later. Do you have one of those stories?
Actually, one of my closest coworkers, she used to be a patient with fibromyalgia, sleeping about 15 hours a day, polymedicated, pain all over. And after we change, diet, emotions, physical therapy, a lot of injections, ozone injections, and major autohemotherapy, she discovered that she was not really happy of what she was doing as her job. She changed careers. She went into aesthetic treatments, and she ended up renting a space in the clinic to be the one that does, the facials and the beauty things for quite a few years. And she used to always refer the patients to me because she would always be saying that before she saw me, she was like in a state of no hope, that chronic migraine, sleeping problems, no energy, really no joy in her life. And of course, she has ups and downs. And whenever she hits like an area where there's pain again in the neck or has to address an temporomandibular joint dysfunction, we address that, but it doesn't become a repetitive pattern of pain. As we age, we also have deterioration of our joints and, normal aches and pains from overuse, but that's not going back to the diagnostic of chronic pain. It's like addressing, like if you twist your ankle, you fix it, and then you continue with your life. So that's one of the stories. Another one is a lady that had business for consulting, and she was okay with the job she was doing. She really liked treating and helping other people, but she was basically a helper. She would always be giving and giving and giving, always giving to others before addressing her own needs. So she was about 2 years into the situation with a lot of pelvic pain. That was one of the main symptoms: pelvic pain, chronic irritable bowel syndrome, and pain to the back, to the neck, and migraines. And after going through through all the ozone therapy and physical therapy sessions, she went into this journey of self-discovery. And she was able to recognize that in order for her to really heal, she was going to have to address her own bodily and emotional needs first before giving all of her time to other people. So in this case, she continues with, the exercises and the dietary changes. She chose to become a vegetarian, and it works really well for her. But she also chose to change the degree of involvement that she has in her company. And she has slowly been able to delegate some of the responsibilities to other people, and made some important changes also in her life family situation. So it's not just the physical and the homeopathics and the ozone. It's also that journey of self-discovery. For each person is different. For some of us, it might be increasing the physical activity. For some other people, it might be staying away from toxic relationships. For other people, it might be changing your job. I mean, your job is really frustrating you so much that your body's screaming every day, please don't take me there. And you develop some sort of multiple symptoms as a way that your body's screaming for help. So my first recommendation would be to reconnect with your body and make your body, like your best buddy, like your friend, and reconnect.
That. I just love that. I love that. I do feel at times, myself, and I think us as a whole, we get so disconnected with all the technology and the needs of society, or the needs of being a father or a mother. And we don't necessarily listen to what our body is yelling at us to do. Yeah. And it wants to work for us. Our body is our buddy. And I just love that verbiage that you laid out there. And it kind of falls into our next segment. Something I ask everybody on this podcast: what are 3 things listeners can do right now, implement into their life today for better health?
Start to ask your body questions. Like, for example, what would you like to do today? Where would you like to go for exercise? What would you like to drink? What would you like to eat? What color would you like to wear? Like, really literally stand in front of your closet and ask your body, what wavelength of color is going to balance my cells better today? Might be green, might be yellow, might be pink. I don't know. But it's an energy, it's a wavelength that changes your mood. So ask your body questions. Whatever has to do with the body, ask the body, and you'll start to get that answer. The other thing is connect more with nature. You mentioned that we're overloaded with, electromagnetic fields and, Wi-Fi's and whatever. So go outside, go to the park, go to the beach, go to your garden, touch a plant, reconnect with the nature. And that's really going to increase your health in ways way beyond any normal treatment can do. And the other is live like a child, with this innate curiosity. Like, don't judge, what you have to do all day, but just simply start to enjoy the moment like children do. Like, they walk, they fall, they cry a little bit, they pick themselves up and they continue walking. They don't judge themselves for having fallen or, scraped their knee. And we tend to overjudge our body so much. Like, why are you sick? Why are you in pain? So just, change that attitude more towards curiosity. And everything else we've talked about, but that's like diet, exercise. I mean, that's a lot of things to do. But basically connect with your body, go out in nature and start living with that curiosity like a child, asking a lot of questions,
I love that. And as a mom of a 2-year-old, I see the disconnect every day on how I respond and am hard on myself, and how she's just like, oh, I fell.
And what a nurturing energy is when you are in front of a child, you just feel great. It doesn't matter if it's your child or not. Whenever I see a baby patient, I get so happy because they just be themselves. They're just vibrating with joy and looking at the world through really, new eyes.
Yeah, quite literally. Well, I just want to say thank you so much for this. This is just such an interesting conversation, again, around a complex diagnosis that I hope someone out there listening can connect to and just find that hope. Guys, if you are out there listening, I also just wanted to say that we talked a little bit about UBI and ozone. We didn't go super deep leveled there, but there are other episodes that address that. So if you're curious, scroll through and find the UBI episode and the ozone episode. Dr. Sara, we'd love to have you back on, frankly, to talk about some more chronic conditions, because I know that you are really inundated in helping people get over that. So maybe in the next year, we'll have you back on this show.
I'd love to. And ozone and UBI are one of my favorite topics to talk about.
Yes, mine too. Well, as always, thank you guys for listening to this podcast of where we're just trying to show a different way to love your body and help it heal. It's a new perspective for you and your chronic illness. If you found something helpful in this episode, please leave a comment, as we really want to walk alongside of you in your healing journey and just support you where we can. So thank you again, Dr. Sara, and we'll chat soon.
Pleasure. Thanks. Bye-bye.